Well, self-advocacy means taking care of your own self. It means looking out for number one, in essence. So doing what it needs for you to achieve the success that you need in whatever the field is. So in the field of healthcare, self-advocacy means looking out for your own personal healthcare without relying on someone else to be the big brother and looking out for you. That means taking charge of your own healthcare, being sure you make your own appointments, follow through with your own appointments, and most importantly, look through your own surveillance. I think even among non-Hispanics, it's a very difficult concept to give yourself and take ownership of healthcare, because I think we just as Americans are very used to having healthcare very easily accessible to all of us. As Hispanics, we need to take advantage of this accessibility to healthcare and kind of own it. Then once you own this healthcare, this accessibility to healthcare, then you can start moving forward and using it to the fullest effect to impact your life and to impact your health also. Giving ourselves permission for healthcare means taking kind of the bull by the horns and taking advantage of what opportunities are available in this great healthcare system that we have in the United States and using it to your advantage. As Hispanics, sometimes we need to be reminded that it's our responsibility to take care of ourselves. Just like we feel it's our responsibility to take care of our families or to put our families first, we have to remember that we have to take care of ourselves only so that we can take care of our families secondarily. In terms of healthcare, there's awesome opportunities here in the United States to have access to the best healthcare in the world. By giving yourself the opportunity to take advantage of some of this healthcare, such as the screening programs or treatment programs once you get a diagnosis, I think as Hispanics we have to be ever vigilant on this possibility for healthcare and how it impacts our life every day. Many people choose to get health care out of the United States. Even some Americans choose to get health care outside the United States, mainly for economic reasons. Whether the reason is economic, whether it's cultural, or whether it's just because you feel more comfortable getting care with someone who you can associate with, I think that's all equally valid reasons. The important thing is that you're getting the health care that people need. I think this speaks a lot to what we were speaking of before regarding the Hispanics not feeling comfortable in the U.S. healthcare system, mainly due to a language issue or due to a cultural issue. If a Hispanic, or whatever the ethnicity may be, feels more comfortable getting that health care in an environment where they feel more at home, then that's the better place for them to get the health care. Of course, my hope as an American doctor is that Hispanics, or whatever the population may be, may feel that sense of comfort here in our system. But any system is better than no system. So I think any health care that the patient gets, regardless of where it is better than nothing. I think self-advocacy starts with allowing yourself to look for the symptoms and know that the symptoms could mean something. So it's not just ignoring symptoms or saying that the symptoms aren't that important to you or don't place as much of an emphasis on your life compared to making the mortgage and feeding the kids and things like that. What I want to say is that these symptoms are equally as important as those other aspects of your life, and that as Hispanics we have to realize that these symptoms are very important and that our own health is just as important as the daily activities that we do for our families. I think all of us are guilty of this whatever will be attitude, because quite frankly it's much easier to ignore things or to think, well, if God's will or this will happen, it will happen, than it is to actually take control of the situation and investigate it further. As a doctor, my job is to look at those things and see, well, one abnormal finding may indicate something more serious or may indicate nothing. But it's my job to look to see whether that is something serious or whether it's something relatively small. I think as a patient we should also take that attitude and not just leave it up to fate or leave it up to something will come of it, whatever what may. I think we have to take advantage of the opportunities that we have here to get the proper health care we need, to look for everything very deeply, because it could be something that could be treated in a very early stage and prevent a major cancer or a major treatment. I think Katie Couric's effect on self-advocacy and empowerment allows people to be not so afraid. So I think a lot of our hesitancy or our barrier to accessing health care or a barrier to empowering ourselves is pure fear. One is not knowing what it is, and two is not knowing what it could do to you. So of course everyone's afraid of something they don't know. I think by Katie Couric's courageous effort in doing a colonoscopy on live TV showed that patients don't have to be afraid of this procedure because it can save their life and it's not as bad as they think. Generally when you don't know something, you tend to assume the worst. And your assumption of the worst is usually far worse than what it really is in reality. Well, as a Hispanic, I think we have many hurdles to overcome, and one of the hurdles in the sense of empowerment is, again, in education. I think in knowing what is a serious symptom and what is a non-serious symptom can empower someone to seek attention only because then they have the knowledge to know that something isn't right. I think this knowledge of something isn't right is something that we all share, but something that some people tend to suppress. And like I said, it's much easier to suppress something than it is to bring it to the forefront. And as Hispanics, we have to acknowledge that this is part of human nature, and we have to acknowledge that it's our duty to bring this to the forefront and seek attention for things that we know deep down in our hearts aren't quite right. I think in the Hispanic community we have a large sense of family that's very important to many Hispanic people. And with this sense of family comes the sense of caring for one another, both the children caring for their parents as a repayment for the parents taking such good care of us when we were young. And that does not just stop with money and caring, it also includes health care. And in the sense of providing for health care for our parents, it's not just take them to the doctor. It's having a daily or monthly or weekly discussion on health care. Knowing what the healthcare issues are in the family will not only help the son or daughter know what their potential healthcare issues may be when they become their parents' age, but it also allows the parent to talk about and become more educated with their condition. That way the parent knows what medications they're taking, what the medications are for, and what the next step in their general health surveillance should be. This allows healthcare to be one of the common topics in the family, not something to be shunned, not something to be afraid of or embarrassed about. It's something that all of us have. All of us have to deal with at some point of our lives. And I think bringing it back to the family and Hispanic culture, where that's so important, allows that discussion of healthcare to be commonplace. We've learned that when something becomes commonplace, it becomes easy to do. It breaks down a lot of the barriers, and that's what I think the role of the family in the Hispanic community is. As we were speaking about before, this notion of the family being involved in healthcare is not just one directional. It does not just go from parent to child, but also from child to parent. And parents must be pay particular attention to their children's welfare. And there's some topics that we don't want to discuss with our kids because they're very hard to discuss with our kids. Issues such as sex and drugs and things that everyone knows they should be speaking about their kids, not to smoke and not to drink, but that's something that's very much a difficult conversation to have that we all must have. Again, breaking down that barrier to demystify some topics. Along the same route is the demystification of some sexually transmitted diseases. We have a lot of literature right now saying how Hispanics are especially prone to some sexually transmitted diseases because we're not getting the vaccinations that we should. In particular, there's an HPV vaccination that all girls and boys should be getting in their adolescent years before they start sexual activity that can prevent cervical cancer, can prevent anal cancer, and maybe can prevent some head and neck cancers. Now, this discussion for this vaccination revolves around the discussion of sexual activity with an adolescent, which is very difficult in many cultures, especially that in a very religious or a very Hispanic culture. So again, demystifying or breaking down that barrier, making sexual activity, making vaccinations part of the normal conversation, breaks it down to the point that that child is no longer wary or scared or worried about it. It becomes commonplace. Much like a Band-Aid, a vaccination is just the same. They feel like that's part of their normal treatment. Just like they get a chickenpox vaccination, they'll get an HPV vaccination. And breaking down that stigma within the Hispanic family about sexual activity in regards to this particular vaccination may help some cancer down the road.